Hi and Assalamualaikum. My name is Wan Akasha Bahri from Group 3 from HP1. Together with my other group members will now present the tragedy of thalidomide. Tragedy when a wonder drug gone wrong. This is the group members of the Group 3. It consists of Zul Majdi bin Zainuddin, the leader of our group, me, Wan Akasha Bahri, Wan Maizatul Nazifa binti Wan Rosli, Wan Nasma Al Humaida binti Wan Muhammad Yusuf, and also Wan Nur Izyan binti Wan Najmi. So this is what we're going to talk about in this video. First of all, we are going to talk about the introduction, the presentation overview, and group introduction, which will be done by me. After that, Wan Mazatul will present to you guys about the history of thalidomide, the background and overview of thalidomide tragedy. After that, the structure of thalidomide, the molecular structure and stereoisomerism in thalidomide, which will be conducted by Zul Majidi and also Wan Nasma. And finally, the aftermath, the consequences and lesson earned from the case, which we will talk by Wan Nur Izyan.
Hi, I'm Mesatu. Thalidomide and the history of the thalidomide. Thalidomide had painted a vast negative history during late 1950s to late 1960s. Thalidomide is a medication created by the West German pharmaceutical company called Chemie Grünenthal GmbH in the 1950s. It was created as a sedative or tranquilizer, but it quickly became popular for treating the morning sickness in a pregnant woman. Thalidomide has been tested on animals, however, this testing was not done to humans or even towards the pregnant woman. Thalidomide was approved for sale over the counter without doctor prescription in Germany in July 1956. In the 1950s, scientists did not know the effects of drug could be passed through the placenta barrier and harm a fetus in the womb, so the use of medication during the pregnancy was not strictly controlled. Actually, it took 5 years to make the link between thalidomide ingested by pregnant women and the effects on their children, since the medicine was sold under so many different names in 49 countries. The UK government did not issue any warning until May 1962. The widespread of changes to fetal development was one reason why academics and doctors were slow to make this connection. Unfortunately, this thalidomide indeed had created a huge implication, especially towards the fetus in the woman. Between 1957 and 1961, 10,000 infants exposed to the drug in utero were born with catastrophic limb malformation called pharmacomelia. When a pregnant woman takes thalidomide early in her pregnancy, there is 20% or higher chance of having a kid with a birth abnormalities.
This is the structure of thalidomide classified under dicarboxamide. The IPAC name of thalidomide is RS2-26-5-pyridine 3-il 1H-isoindole 1,3-2-histidine. With molecular formula of C13, H10, and 2O4, thalidomide owns a cyclopentane, a cyclohexane, and an aromatic ring, as well as several functional groups. For instance, 2 ketone groups and 2 amide groups. When we talk about thalidomide, the first structure that comes to our mind is the structure above called R-thalidomide. At the same time, thalidomide also exists in another form known as S-thalidomide. Generally similar to R-thalidomide, it has a molecular formula of C13, H10, and 2O4. However, in two-dimensional space, S-thalidomide and R-thalidomide are simply not the same molecule, in a phenomenon known as stereoisomerism.
As stereoisomers, R and S thalidomide are known as a pair of enantiomers. Due to the presence of a chiral carbon in the molecule, thalidomide exhibits chirality, in which the mirror images are non-superimposable. The easiest example to demonstrate chirality in nature are human hands, They are not superimposable no matter how much we try to rotate them, despite being mirror images of each other. Therefore, when we see these images shown here, we could never find a way to put both molecules on top of each other accurately. In the case of thalidomide tragedy, people back then were unaware of how much a minor difference in the structure of thalidomide could affect its function on human use of the drug. Only then that we know that R-thalidomide is the only form of thalidomide that is useful for treating some conditions. As thalidomide, on the other hand, is the culprit for causing baby deformities and also death in the thalidomide tragedy. Moreover, as enantiomers, thalidomide exists as a racemic mixture, which is a mixture of both thalidomide in a 1-to-1 ratio, making both of them hard to separate from each other.
Moving into the aftermath of thalidomide. So in this aftermath, it is divided into 3 parts. The first one is the physical properties of thalidomide. The second one is the thalidomide as racemic mixture, and the last one is the uses of thalidomide today. Is the main physical properties of thalidomide. The first one is its molar mass. Thalidomide has a very high molar mass, which is 258.23 gram per mole. Why it has a very high molar mass? Because we know that the molecular formula for thalidomide is C13H10N2O4. So basically, the greater the number of carbon atom, the greater the molar mass. And the second one is its boiling point, which is 509.7 degrees Celsius, and its melting point is 270 degrees Celsius. So basically, thalidomide is a very stable drug because it does not boil and melt easily, and this is one of the reasons why we cannot separate thalidomide into R and S enantiomer, because of its high boiling point and melting point. Moving to the next point, thalidomide as racemic mixture. So this is another prominent reason in why we can't separate thalidomide into R and S enantiomers. Firstly, thalidomide is chiral and it is a racemic mixture, and efforts to develop a stable single enantiomer of thalidomide is impossible and useless, because dosing a single enantiomer of thalidomide doesn't have a unique therapeutic value, because the drug converts to racemic compound in our body, which have the teratogenic activity, which is the S enantiomer. Okay, so for example, if a doctor prescribes the pure R enantiomer to a patient, he or she cannot avoid the harmful side effects, because the R thalidomide will interconvert by changing into S thalidomide, which is the bad one. Okay, so they will actually still develop all the disease and the side effects of thalidomide. The history of thalidomide does not end there. Thalidomide is still used today, but in different way, in which they are used to treat leprosy and cancer. In 1964, a leprosy patient at Jerusalem was given thalidomide when all tranquilizers and painkillers does not help him. So his doctors noticed that his leprosy symptoms had been decreased. Within 3 days, the leprosy had gone and his skin lesions healed. So when the patient stopped taking thalidomide, the leprosy symptom returned. In addition to that, it has been used successfully to control some AIDS-related conditions and a targeted cancer drug. Other than that, thalidomide is also used to regulate the body's germ-fighting immune system and helps to control inflammation, because it slows down the process of creating new blood vessels. And the other side effects include blood clots in the leg, deep vein thrombosis or near the lungs, because the blood slowly flows in this area, drowsiness, rashness, as well as dizziness. Another drugs that are similar to thalidomide, but fewer in their side effects, which is known as lenalidomide and also pomalidomide. In conclusion, before you begin taking thalidomide, you must undergo counseling session to know more about the potential side effects of thalidomide. So that's all from our group. Thank you.